You know, men are never given center stage. So today is your day. Give me a 3. If you are a man or identify as a man, please give me a 3 in the chat box. Today I'm at your service. Good.
We are here.
Karibuni sana. I will share my screen shortly as I probably get started. I don't know if you can see my screen.
Yes, you can see your screen. Proceed.
Perfect. I would like to talk about the male sexual dysfunctions, and there are very many, totally. We can't cover them all today, but at least we'll pick the most common one, which is usually the erectile dysfunctions and all. Now, the reason why we thought to pick this topic is because I think we had our discussion in Malindi, and we were saying men rarely speak up. Men will rarely tell you what is going on. Men will rarely declare their problems. They are taught to shoulder the weight of the world and the weight of their failing reproductive organs as well. And so we are here to help where we can. So my name is Dr. Swabra Swaleh. I am a consultant obstetrician gynecologist, trained in Makerere for my MMed. I also have an MSc in sexual and reproductive health from University of South Wales in the UK. Yani tukisema tunaongelea maneno ya reproduction, nimeyasomea, okay? And so basically, as we start, I would like to, just a minute, I would like to push this away. Good. We can't start talking about the male reproductive system without necessarily touching on the anatomy. And so when we're talking about the anatomy of a male reproductive system, this includes the external genitalia, which is the penis itself, the testis, and the scrotum. The scrotum is a sac that holds the testis. And then the internal parts, which usually would include the prostate gland, the vas deferens, the urethra. And basically your fertility and sexual traits depend on the normal functioning of your reproductive. And that is the inside and the outside in intertwinement with the hormones, with the nerves, and with the psychology of a man. And so that is what I'm referring to. I tried to put them in different colors so that you can identify who is who. And this is a very simplistic diagram. The thing with 2 horns you see at the very top, that's a bladder. And so you cannot differentiate the reproductive system and the urinary system because they're almost one and the same, but they're not. But it's important that you see them together because you know that they have one outlet, which is the urethra, and they actually interplay into each other, meaning one failing side could also affect the other side. So that's a bladder at the very top, and you can see the bladder will exit through the urethra. Just beneath the bladder, you can see that bulb right there, still in pink, is a prostate gland. And it's important to mention this. You're going to hear a lot of prostate. From the time you get to 40 years as a man, the prostate gets mentioned a lot because it has a potential. If you are a normal functioning man full of testosterone, it has potential to grow bigger past its expected size. And when it grows bigger, then it starts bringing issues. And those issues could impact on your urinary health and also could impact on your sexual health. And then what you see in purple, starting from behind the horns, is the seminal vesicles, okay? And you can see that there's a tube running all the way down. So actually, let us start from the testicles so that now we join the epididymis, that sac that you see running up, and then the pipe that you see on both sides climbing up, which is a vas deferens. For fun fact, if you're to ever get a vasectomy, at that point where you see the circular point where I've put the circle, that is probably where we would cut the vas deferens to give you a vasectomy. And it empties into the ejaculatory duct after mixing with fluids from the seminal vesicles, the purple horns you see at the very end, and then eventually everything gets emptied again through the urethra. So the urethra is a very important tube because it lets out several things in different systems, very paramount in the male. Good. And when you're talking about the physiology of a reproductive system, and here I'll narrow in on the physiology of an erection, I do not want to enter the detail of, but let's just say that it's an interplay between what would term the sexual stimuli. Men are visual creatures, olfactory centers, that means the nose, okay? Imaginative, tactile, and sometimes taste, okay? So that interplay between the sensory organs, okay, the 5 sensory organs, gets to interplay with your hormones, your neurotransmitters, and neurotransmitters are chemicals that are released by your brain to sort of control organs outside of the brain. Okay, so with the neurotransmitters, we're talking about melanocortins, dopamine, oxytocins, nitrous oxide, and then we're talking about the nervous system. And here we're talking about the sympathetic versus the parasympathetics. Meanwhile, biology. Okay, good. And then it interplays with hormones as well. And then it interplays with muscles. And then it interplays with the blood system. So you can tell, you can't pick one system and say that this is a system that is controlling, the male erection. This is a system that is, everything comes together. And when one fails, then the rest have potential to fail. I have been told that I could potentially be a very fast teacher. And so if I am fast and I've lost people behind, kindly let me know so that I go a bit slower. Good. So what usually happens in an erection? Basically, a man would see, a man would like, a man would think, a man would imagine. And so all these all these sensory stimulations are sent to your brain, and the brain acts accordingly. It releases neurotransmitters. These now act on the organs and especially transmit nerves, especially on the lumbar nerves. So we're talking about the nerves starting from your pelvic area around we call them T11 to L2, somewhere below your waistline, okay? So these nerves send signals to the muscles of the penis, which now allow some things to dilate, other things to contract. So which things are these? So in the penis itself, we usually have a muscle called the corpus cavernossus. What usually happens during an erection, blood is pumped, and so then blood from the arteries come rushing in through the corpus cavernosum, and it gets filled up with blood. Now, in every blood system, there's what brings blood, which is the arteries, and then there's what takes blood away, which is a venous system. So as the active arterial system pumps blood in, what happens to the venous system? It sort of locks so that it doesn't drain the blood away. So this blood that is rushing in is trapped in the shaft of a penis. And so then you have a turgid penis full of blood, and it's trapped there, meaning there's no backflow until such a sensory stimuli is already sent again to say, give instruction that, hey, release, we are done, or release, we are no longer needed, or release, you understand, yeah? So basically, that's how it works. And so when you're talking about the male erection, there are several stages to it loosely. So there's usually the latent phase where the sensories are coming in, and then there's the erection, and then there's the turgidity stage, and then finally, there's what we call now the refractory, or when things are pulling back. So of course, there are a bit more details in it, but that is the thick and thin of it all. And so what then is erectile dysfunction? A man is considered to be impotent when he cannot acquire or sustain an erection of sufficient rigidity for sexual intercourse. So any man may at any one time, this just simply means that usikose kuinua siku moja and you start panicking that now I have erectile dysfunction. No, the term impotent has to be reserved for those men who experienced repeated erectile failure during attempted intercourse for more than 75% of the time. Okay, be kind to yourself. The machine can fail once, twice, or even thrice. Okay, so what are the common causes of erectile dysfunction? Tobacco use, and I'll be quickly. Mary Onduso, tafadhali usishike screen yangu na pia usishike reproductive organs zangu. Thank you very much. So why tobacco use is a big issue? Simply because, as we know, cigarette smoking usually damages endothelium. And what is endothelium? Endothelium is when we're talking about a blood vessel has the muscle layers of it. Now, when you damage the muscle layers okay, of the blood vessels. We've already talked about blood vessels here. The blood vessels receiving blood, the blood vessels that are supposed to be taking blood away, the blood vessels that are supposed to be pumping things in, their blood vessels. We need a lot of blood vessels working properly. Now, when you're smoking your cigarettes, you're compromising that. You're making them a bit rigid. You're making them a bit not able to, you know, contract and dilate accordingly. So cigarettes do that a lot. So there are other conditions, for example, Peyronie's disease, which usually can cause a lot of pain during sex. This actually gives the telltale bent sex, okay, when you are erect as a man. And that usually most of the time gets shorter with erection or a lump or a bump. So basically, it's sort of like a muscle disease that does not allow the muscle to sort of fully elongate. It's sort of like a contracture, you know, like when you burn your hand, and so that can happen with Peyronie's disease. Overuse of alcohol, what usually happens with alcohol, illicit drugs, is they go to your brain and then they tell the brain that, hey, you don't need to release so many neurotransmitters. You can reduce a little. And when you reduce a little or reduced amounts of neurotransmitters, then for sure, the neurotransmitters that are supposed to be giving signals to the organs that, hey, let's get erect, may not exactly do that and work accordingly. Sleep conditions, and in sleep conditions, especially if someone doesn't achieve what we call REM sleep. REM sleep is rapid eye movement. So in sleep, there are usually stages of sleep. And at different stages of sleep, usually we can assess how the nerves work and how well they work and how. So if someone that has a sleep condition, meaning they're not well rested, the nerves are not working well. So this can also affect your sexual performance. Treatments for prostate cancer or enlarged prostate, what we call benign prostate hypertrophy. Now, treatments here could include surgical treatments and could also include medical treatment. I'll narrow in on the surgical treatment. In the hands of a careless surgeon, in the hands of a surgeon that just, you know, goes in, removes the prostate carelessly and tampers with the nerves. Remember, I mentioned T11 to L2. That's a section of your lumbar area. The spinal cord has different segments and each segment has a name. So the segment near your waist, near your tailbone is called the lumbar area. And that is where most of the nerves that actually control your erection as a man emanate from there. So if I go yanking things out, if I do pelvic surgery, okay, around that area, not just the prostate as well, if I go operating on that area and I'm not careful with those nerves, I could sever those nerves. And then now we're left with nerves that are, you know, not functioning and firing as they should be. And then, of course, low levels of a hormone, testosterone. And testosterone here is usually the master hormone. Every time we're talking about the man and the libido and the desire for sex, we definitely almost always go back home and have to mention testosterone, okay? We're still not done. Parkinson's disease, this is a disease that affects the central nervous system that is in the brain. Remember, we talked about the brain sending neurotransmitters. Now, if the very brain is already compromised in Parkinson's, where the nerves are not firing as they should, then for sure, we're going to have nerves firing in the wrong way, and then also instructions not being given the correct way. Multiple sclerosis, certain prescription medicines and side effects, especially. So most of these here allude to pressure medication, okay? So most of the pressure medications, usually the thiazide diuretics, the spironolactones, most of them, what they do is they usually end up, especially the diuretics, you are inducing a state of where the body is forced to lose fluid. And remember, we need a lot of blood, a lot of fluid to keep getting pumped to where it is needed, which is the shaft of the penis. So if you are losing fluid by means of medicine through your kidneys, then we may not have enough fluid in your body circulating to give you an adequate erection. I hope all these things are making sense. And so that I'm not leaving you behind, kindly feel free to post your questions. I will come back to them. Good. Other causes are usually mental or psychological, and 90% of most erectile dysfunction, actually, most of them, if you are to work these men up, there's nothing physical. Most of it is usually as a matter of the interplay in your brain. The brain plays a very key role in getting sexually excited, and it starts as an erection. So things that can get in the way of sexual feelings usually can add to the diagnosis of, and these include, but are not limited to, depression, anxiety, or other mental health conditions. Stress, my friend, stress is a big factor. You ask a broke man, ask a man who's busy looking for, sustenance, ask a man who has a lot of things on his mind. If he can lift that thing up, he cannot, my friend, he cannot. That thing has a mind of its own. And when things are not aligning between the big brain and the small brain, things don't stand. And then, of course, marital issues with a partner, where if communication is not through and through, and communication here is two-way, okay? So if that is not through and through, then for sure, then of course also the sensories coming in are not exactly aligned. So you have known what it is, you have known what exactly it presents us. I would like to take you through what exactly we usually evaluate. And before I do that, I will quickly go to the chat so that I see that I have not left my people alone. I see a lot of number 3s. I see lots of men joined us today. And I see a lot of you laughing. Okay. Karibuni sana. Yeah, perfect. I've not lost much, and I don't think I've left a question behind. As a doctor, what exactly am I looking for in my assessment of these men? The most paramount thing, the first thing you do is history. They tell us in medical school that by the time you're done talking to a patient and examining that patient, even before you do any test, before you give any drug, you should have, first of all, 90% of your diagnosis, and then you're sort of halfway through your treatment for that patient. So history taking is very important. And so these are the questions you may want to ask towards their sexual history. Are you having sexual relations currently? Because there's a difference between you not getting any and you having issues with your erection, okay? And if so, are you having this sex with men or with women or with both? This plays a fact in the erection. And if not, when did you last have sexual intercourse? Are you satisfied with the frequency and quality of your sexual experience? And usually here I give a scale of 1 being totally not satisfied, a scale of 10 being I'm over the moon. Do you have more than one sexual partner? Are these problems the same in all the sexual partners? Not insinuate that the problems are brought by the partners, but you want to know, is it a standard thing in the person presenting, or is it a recipient thing? You have to assess libido, arousal. Do you have sexual thoughts? Do you even think of sex to start with? Okay. How often do you want to have sex with your partner? We will be talking about erectile dysfunction here. I think you may have a problem. And your expectations are very different from those of your partner. You may have a higher libido than your partner. That there's nothing wrong with you. Ama you may have a slightly lower libido than your partner. Your partner is female and she wants a lot of sex. And you're there thinking once per month is perfectly okay. So those are the questions we need to assess. Assess erectile function. And erectile function here, the questions I will ask are, how often do you get an erection when you want to have sex with your partner? Like when you're thinking intentionally. Aki Elijah, mimi msishike screen yangu tafadhali, na erection zangu muziache tafadhali. Okay? All right. Good. Do you have nighttime erections? This is actually very important because, for example, if a patient tells you, yeah, doc, me, when I wake up in the morning, I have a very good erection. And most men will tell you in the mornings, and even not even just men, even small boys, okay? Usually they'll tell you in the morning, I have a good enough erection. If you have a good enough erection in the morning, untouched and provoked by itself, usually that tells me your nerves are working fine, your hormones are working fine. Probably we're talking about psychogenic erectile dysfunction here, that which is brought by, maybe your thoughts, maybe your depression, maybe other things other than a physical cause to your erectile dysfunction. You have to assess ejaculatory function, my friend. Do you ejaculate too early? Is it too early? There are those people who just go and go and go and go and they don't ejaculate. The standard man, and this now I'm speaking as a doctor, is basically between 10 and 15 minutes. There's no superman in the bedroom. If you're taking longer than 15 minutes, your partner may not say it, but it's probably rough and bruising. If you're taking shorter than that, maybe they're also not saying, but it's probably not quite there yet. So are you, functioning as per the timelines, okay? Is it too difficult to ejaculate? And catch this. Are you even ejaculating? Because there is something called retrograde ejaculation, that a man would have a sensation of having an orgasm, and instead of seeing fluid, semen, whatever coming out, it actually falls back. And this is why I'll take you back to the anatomy picture I gave you, that you have to look at the relation of the urethra, that which serves the bladder, the urethra, that which serves your reproductive organs, and the same urethra, that which serves the prostate. So there are people who, in the middle of, at the end of sex, instead of the semen coming out, it actually falls back in the bladder. And actually, these men would come in with infertility because you're waiting for sperms at the very end of the shaft. And if you do a semen analysis, you'll find that it's actually 0 sperms collected. But when you do a urine analysis, you'll see sperm swimming. I've seen this severally in my practice, and it is the most interesting thing to assess. The chart is building, and I hope you're all fine. Yes, there's a big brain, Donvin, Oguda, and a small brain, and each thinks independently. Okay, perfect. Now that we've talked about the evaluation, you have to go in on the physical exam and the lab assessment. And here I said, as per the differentials, and I'll take you through it. What do I mean? That by the time I'm done talking to you, I may probably have a feeling where the problems could probably be coming from. And so if it is a hormonal issue, for example, your pituitary gland is a bit hyperactive. That is why we're having issues with our erections. To assess pituitary function, I may want to look at the breast of this man. Are they growing bigger than a normal man's? And that is totally assessed in a physical exam. You're looking at the man from head to toe. I'm looking at this man and I want to assess, are the sexual characteristics that are typical of a well-matured man available? Do you have armpit hair? Do you have a beard? Okay, sikanyagi, those who don't have a beard, there are men who have no beards. It doesn't mean you're not fully matured. Do you have pubic hair? Is a pattern of pubic hair growth that we expect of, oh, my cat is here, that the same one that we expect of a grown man, okay? So there's a pattern, and how pubic hair develops, by the way, says a lot about what hormones we're working with, what is sufficient, what is not sufficient, okay? So basically, I'm assessing the breasts. Are they overgrowing? Is there estrogen sources anywhere? I'm looking at your midriff section. I'm looking at your abdominal area. Do we have signs of adrenal excesses? For example, there are people who have adrenal gland issues, and around the tummy area, that area is much bigger. They sort of look like a widened cylinder at the midriff area. Nasimanishi kitambi ya kula nyama choma na kunona. No. I mean like adrenal gland issues, okay? I'm looking at your skin changes. Are there vascular issues, okay? That will tell me, do we have an inborn or an, underlying skin issue, an underlying vascular issue, an underlying, for example, varicose veins can tell me a lot about how your veins are working, okay? Many issues. I'm also looking at your head. Baldness is a very good indicator of where our hormones are, okay? I'm looking at basically the whole entire man in the examination. I'm looking at your genitals. Are they well developed? I am palpating the scrotum. Is there anything in there? We could be talking about erectile dysfunction. And kumbe, we left the testis in the abdomen when we were developing, okay? What we call cryptorchidism, or undescended testis. So you palpate. Does the testis feel, or the volume of that testis, the size of that testis, does it feel like a normally developed testis? Does it feel like it has developed to its full size? Ama it looks a bit minute and tiny like a pebble? That should also tell you about the functioning of that man's hormonal milieu or hormonal system and hormonal environment, okay? You want to assess other things as well. And this is where now you're starting to assess, what are they called? Signs. Signs meaning I want to assess reflexes. There's something called the climateric. So I know I've spent a lot of time on this slide that has no word in it, but I would hope that you're all with me. So if you're all with me, kindly, please put it in the chat box. I want all of you to tell me, are you with me? Say we're with you. Tafadhali niambieni. We're on this empty slide, and I feel like this slide has a lot. Are we together, especially the men? Are we together? Okay, perfect. We are together. So there's something called cremasteric reflex. What is cremasteric reflex? That should you stroke the inner thigh of a man. Those with partners today, kindly, that is homework. Carry home. Andika homework kwa chat box. Yes, sasa ni homework, okay? Go stroke the inner thigh and you should see the ipsilateral. Ipsilateral meaning the sac on that side of that thigh. So if it is the right, the scrotum on the right side, it should shrink and jump up. That is a proper reflex. That is homework I'm giving you. That is a normal response to touch in a grown man, okay? Good. So, mwende mkafanye homework. Tafadhali tuangalie kama cremasteric reflex iko. This is usually an indicator of a hormonal, okay, environment of this man's body. Perfect. We're still examining this man. Once we're done examining the physical body, you may want to run a few tests here and there. And what tests are these? And every time in medicine, we're running tests, and sometimes this usually comes up, daktari, amemaliza pesa zangu zote, just by doing tests. Lab tests here are usually to do three things. Number one, confirm your diagnosis. That means you're ruling in your diagnosis. You're also ruling out other differentials. Differentials are conditions that may present as a thing you're thinking is happening, but you're not quite sure. So a test can actually be done to rule out that which you're not sure is happening, okay? And then also make a diagnosis of other related things. So tests also here sometimes act to count as a baseline. And what is a baseline? If I'm worried that your hormonal environment is not okay, your testosterone levels are not okay, me doing that first test is acting as a baseline. Because remember, management is going to come in. I'm going to give you something later on. I'm going to do a semen analysis, and I'm going to do, or rather, I'm going to give you something for, maybe say the low sperm count. Now, after I've given you that medication, after I've given you that supplement, after I've given you that treatment, for sure, I want to assess, is the treatment working? So this same lab test can be repeated later as a marker of improvement or deteriorating disease. Okay? Perfect. Tuko pamoja. Now, you've assessed the man physically, you've run the labs, and so here labs can be as many, as little as what you're potentially thinking. So you're thinking nerve issue, tafadhali, do all the nerve conduction studies. You're thinking it's a hormonal issue, run your testosterone, run your DHS, run your pituitary hormone, pituitary gland hormones, the prolactins, run your estrogen levels. There are men walking around with ectopic sources of estrogen, and that counteracts the effect of a testosterone that they should be having, and that should be working for them. For those that don't know, estrogen is a female hormone, and in any one body, usually a woman would have a dominance of estrogen and a little bit of testosterone. It's needed. Even though you're a woman, you need testosterone. It gives you a few other characteristics, your libido, your hair growth patterns, and et cetera, et cetera. Fun fact. Have you ever wondered why men have such perfect eyebrows and such perfect hairlines, and yet they don't need them? Testosterone, my friend. So women who have slightly higher testosterone, you see that the hair is thick, the hair is, things are working, libido is up the roof. Same applies that the dominant hormone in men should be testosterone. And if you have this man with estrogen dominating, then you're getting this man with overgrowth of, say, for example, boobs, gynecomastia, sauti inaanza kuwa nyororo, mpaka tunaanza kushangaa hala, ni nani ameguruma, ni nyau ama ni lion, okay? So basically you want to assess such things. Perfect. And then how do you treat? Imagine even me, I don't know, because you only treat according to the course. So usually I narrow in and I say, now that we say 90% of erectile dysfunction is usually as a result of, psychological factors, only 10% is found in the physical or identifiable causes. Then it will also mean that the first thing we'll try and fix is our lifestyle. You're taking alcohol, stop. You're smoking, please stop. If you cannot stop, then try and reduce, okay? You are obese, kindly start working out, get into the proper BMI, Okay, you are not sleeping well, kindly create a sleep routine, practice sleep hygiene. Those are things like meditation, winding down routine, basically all those things that help you get into this wellness state. Okay, you are stressed, find a shrink, talk about your issues, sort your issues. Okay, modify your lifestyle. You have to work on your nutrition. Hey, my friend, we cannot run away from nutrition. Nutrition follows us everywhere. Actually, they say, let food be thy medicine. Most of the conditions that we have, and it is not just chronic conditions like hypertension, diabetes. Every time we talk about nutrition and chronic conditions, those are the big ones. Heart disease, that people go for cholesterol. No, even erectile dysfunction, my friend, if you're eating badly, it shows. It may not be a direct correlation, but they are all intertwined, okay? A regular medical exam once per year. Are you having your medicals? Are you looking at your cholesterol? Are you looking at your lipid profile? Please, are your vascular systems working okay? We're expecting them to pump blood. Are they even pumping blood for themselves, for the heart even, leave alone the penis? Because if you're not even pumping enough for the heart, how do you leave surplus for the penis? Okay? Is your hypertension controlled? Okay? How are you keeping track that your body is in optimum function, if not for regular medical exams? Okay? Assessment of a medication that you are on, especially for those that have chronic conditions. You have hypertension, you have diabetes, you've been put on drugs. Good. You have pulmonary edema, you've been put on drugs. Good. But these drugs, were they just given? Alafu, you threw away the doctor's number and there's no one following you. Okay? There's no one assessing. Was a dose excess? Was a dose, is it even sufficient? Is it working? Are we getting the desired complications? Do we have, okay? I mean, are we getting the desired effect and do we have complications? I will tell you for free, there is no treatment from mainstream medicine that I will ever give you that does not have potential complications. Hata Panadol, paracetamol. Panadol has a capacity to crush your liver. Sembuse, hypertensive drugs. Sembuse, diabetic drugs. So every drug that you're on, a constant assessment, periodic, and usually a good doctor will give you a return date, maybe 3 months. Let us see how your pressure is doing. Let us see how your lipids are doing. Let us see how your cardiovascular function is doing. Let us see. Even a therapist will counsel you and will give you a return date so that they see how are you doing. Okay? Good. Are we together? If we're together, please write psychotherapy because that is my next point. Psychotherapy in the chat box. Psychotherapy. Okay? Psychotherapy, my people. Good. We're together. So psychotherapy is where now we assess your mental health. Thank you, thank you, thank you so much. I see all of you psychotherapy with me. I see all of you. Good. So psychotherapy is now where we're taking care of your mental health and we're dealing with the issues one by one. Okay? Remember, a big chunk of erection comes from your neurological assessment, comes from your psychotherapy, comes from your mental state, comes from your wellness in your head, comes from your relations with your partner, comes from so many things. So I would like to know, are you okay? Who is following you up? Do you even have a therapist? Are you sorting out issues? Okay, these issues, if they're not, issues that can't be fixed, for example, if they're issues that can be fixed, who's helping you fix them? Okay, you cannot go through this life hoping that you will sort of power through most of these emotional issues. Okay, some you may need professional help. And so this is where psychotherapy comes in. Thank you, Florence. Thank you, Jen. I see you, Esther. And most of these people replying are women. Muko hapa on behalf of where? Where are the number threes? Number threes, muko. Naona wanawake tu wakisema psychotherapy. Okay? And yet, I'm not talking about their erections. Okay? But we are together. Kevin, I see you. Tumeingia gear 2. Naona Ochieng. Good. Then we talk about sensate focus. And sensate focus here is, I'll actually take you through it. When you're talking about assessing and managing a couple, especially for those that probably have premature ejaculations or not getting erections, or even libido issues are, libido is an issue. And this applies to both men and women. Sensate focus is a kind of therapy where, so imagine you come to the shrink, and of course you state your issues, and it doesn't have to be a shrink, by the way, it could be a gynecologist. Perfect. And so you state your issues, and I usually say, let's strip it back. Stripping it back means like we strip it to the bare minimum. We start from the very beginning. Sensate focus means, please, wacha pressure, wacha kuperform mwanzo, tuanze na ABC before we go writing compositions. So what does that mean? It actually simply means tell the partners to, for example, sit facing each other, hold hands only, and look into each other's eyes in silence. And then they get comfortable doing that. And then you can say, hold each other's hands, maybe strip upper body, don't touch anything, it's just holding each other's hands. And then you graduate, and you're graduating step by step and step by step, and you are sort of building up, okay? You are building up to where now we finally allow for touch, for, for play, for foreplay, you start from the bare minimum, where no one touches another, fully dressed, to, partially dressed, to stepwise graduation, towards you're allowed only touch and not foreplay. You're allowed, start, stop words being the key words. You're sort of teaching communication afresh. Hapa mambo leo ni live, my friend, okay? This is actually how we usually take couples all through. Uko na haraka sana, uko na pupa sana. Let's go back. You leave your erectile dysfunction alone. Let's go back to, do you even know how to sit in silence with your partner? Can you look at your partner and get turned on just by them taking off a top? Can you look at your partner naked? That is treatment. That is sensate focus. This is your homework as well for today. There was cremasteric reflex. Now there's sensate focus, where we are graduating finally towards, penetration. That penetration is a final reward. And usually I've seen this works a lot to take off the pressure of performance. And this is what usually happens, okay? When we talk about erectile dysfunction, it's sort of like a vicious cycle. Mwanamme atakosa, hey, my God, I just realized if my audience was any other, nation other than Swahili, I've done you a great disservice. I'll stick to English. So a man would probably lose an erection or have a disorder or, something, but he will probably not perform well once. And then from there on, he will sort of get stuck. And he's always afraid that the next time he attempts, it might fail. And because of that, you cannot start intercourse or you cannot start relations with that, because remember, your stimuli is already messed up. So that is already a negative feedback. You will not lift that penis if the first thought you have is, what if it fails? Because then it will fail. And then now imagine it fails a second time. And then it just affirms that things are actually wrong with you. And then now it becomes a repetitive cycle. So the whole point of sensate focus is to take the focus away from you performing. Let's go back to basics. First, let's establish, do things even work? At this point, sometimes I may even ask you, when you touch yourself, when you rub yourself as a man, does it come up? And the answer would be yes. But when I'm in front of her, it doesn't come up. Then you know, here, there's fear of performance or fear of failure. So you know where to focus your treatment on, either psychotherapy, sensate focus, or even sex therapy. And sex therapy here is where there are no holes back. Like here, all gloves are off. And you have to consider the cultural implications of a couple in front of you. Fun fact, I have delivered a virgin. Don't ask me how. I'm a gynecologist. I deliver women. How a virgin got pregnant. And it's not just one in this Mombasa of ours. I have delivered actually several virgins. Like she's coming fully pregnant and we're wondering now, where will this baby pass? Because hapata kukwa na kitu. And that tells you, probably there was no even penetration to start with. And that tells you, probably communication. How has there been no penetration? And yet this person is fully pregnant, okay? This is true story, by the way. I have delivered a virgin. So sex therapy here means we get down to business. Touch here, show here. You also have to address those who have had FGM. A girl has had FGM, and we have several tribes in Kenya still actively doing that. And so if the clitoris is out, and the clitoris is, the major organ in this reproduction of hours. And so the woman is, and then now the man is feeling like he's not performing enough. So all these things come into play. So in sex therapy, usually we now go to the actual couple. We actually teach, do this, touch here, do da 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 da, tailor it to them according to their cultural affiliations, according to their religious affiliations, according to their, we teach mpaka foreplay. Okay? Supplements. Supplements are just nutrition compacted into the purest self. Okay? We have, I'm going quickly through it because that is where I'm going to hone in on my presentation. And then we have penile implants. Yes, they're available in this Kenya of ours as well. Penile implants is where now we have issues that have neurological implications, that I may want to actually put an implant or a pump in your penis to help you lift it up, especially for those that are either curved downwards, upwards, they're not feeling enough. You can have an actual active pump pumping. We have intrapenile injections of certain fluids that can help maintain the turgidity of an erection. And then we also have testosterone as a supplement or medication. Of course, we have the libido enhancing drugs, the Viagras, the medications and all this we can actually talk about in detail in the following slides. Paka hapo. Tuko sawa? Naona tuko sawa. Naona mko active kwa chats, okay? Good. So we have looked at treatment, and as I said, I may want to quickly narrow in on nutrition, okay? What did I say? Let food be thy medicine. Now, there are common foods around us that you as a man, you should naturally, I want all the men with pen and paper, I'm a screenshot. You as a man should naturally want to reach out for these foods, okay? Watermelon. First of all, the fact that it's a fruit, but it's 99% water. Remember, we need fluid for things to become hard, okay? So please hydrate, hydrate, hydrate. But watermelon also is known as a natural form of Viagra. It has L-citrulline, which is also known usually for blood flow, okay? One of the best fruits for erectile dysfunction. Why? Because it contains lycopene. What does lycopene do? It improves heart health. Okay, what does heart do? Heart is a major pump of the body. It improves blood circulation. When blood is flowing well from the heart, it flows well in the rest of the body. So you need your watermelon. Other foods, especially that are very rich in lycopenes, okay, are guavas. Although guavas here will give you constipation, and like watermelon, we have tomatoes, carrots, apricots, and pink grapefruit. I went ahead so that in your forever living box, you as an FBO, okay, what is the equivalent of what you have that can provide lycopene in plenty forever daily? Okay, I know most of us were concentrating on the male pack, but this is actually, if you look at your forever daily, it has 55 essential multivitamins, and one of those that has come out strongly is lycopene. And lycopene, Atei, please, tafadhali usishike lycopene yangu. We need the heart and the penis to pump well. Okay? My screen is dirty. You people, why do you all have the instinct to touch? Consent, people, consent. Don't touch my screen, people. Okay? Good. Dark chocolate. If you thought chocolate was a reserve of the females, think again. Dark chocolate here, we're talking about chocolate with a higher percent of cocoa. So these are usually rich in flavonoids, which improve blood flow. Also, they have phenylethylamine, which is a mood enhancer. Okay? So that is why chocolate, same way we usually say it's an aphrodisiac for females, okay? We give them as foreplay. Men also should be given chocolate as an aphrodisiac. Now, the equivalent of a product that we have in our basket that can mimic this, okay? Especially the phenylethylamine is bee propolis and lithium, okay? Mwanzo yo lithium with the antioxidant properties, very good. Not just for gastric, also for the reproductive system. Then we enter spinach and other green leafy vegetables. We're talking your mchicha, your mkunde, your skuma, okay? All those things. What are we looking for there? We're looking for folate. Now, research shows that men with erectile dysfunction tend to have low folic acid levels. The number one product we have is vitamin B12 and folate. Okay, you have it. You have it. Kindly supplement these men because improving their folate levels improves the quality of their erection. We are going on. We're now on the proteins, especially in number 4, almonds and other nuts. Okay, so when you're thinking nuts, you're thinking cashews, you're thinking almonds, we're thinking so many other nuts. Okay, they contain amino acids. Amino acids usually act as building block of protein, building block of many hormones. So if you do not have the basic building blocks, that means even some of the hormones will become deficient, okay? So I'm talking about arginine here, glutamine here, tryptophan, tyrosine, okay, phenylalanine, which are also good for the heart health and blood flow. So on the other hand, walnuts especially, and I like this. When I was a young child, yeah, I used to wonder why different nuts would have different shapes. I don't know if anybody ever wonders that. If you've looked at a walnut is shaped like the brain. It has this side, and in between the two sides, it's joined by like a bridge, exactly how your brain is usually shaped. And by all means, the fact that it resembles a brain, I usually say that's the easiest way to remind you that walnuts are good for your brain. Why? Because they're rich in omega-3 fatty acids. That was just a by the way, okay? But yes, walnuts are very rich in omega-3 fatty acids, and this improves blood circulation. So here, fikiria tafadhali, your Arctic Sea. Every time you hear omega-3s, fatty acids, sijui, blood circulation, heart, tafadhali, think Arctic Sea. And by improving blood circulation from the heart, overall sexual function is also greatly improved. Pistachios contain antioxidants, so include a handful in your daily foods for a very hard erection. So here we are thinking Forever Light, which is your building block for your proteins. And here you're thinking your Arctic Sea, which is your source of omega. Okay, good. We're still going on. And these are all foods that are available to all of us in this Kenya of ours. Okay, apples and berries. Every time I mention the word apple and berries, the first thing that comes to my head is a berry nectar. It is the one product we have that has stood out above and beyond. And every time I mention berry nectar, somehow in my head, the words Chisandra berry comes in. Those who know. But apples, blackberries, strawberries, pears, and other citrusy fruits are very rich in flavonoids. And what do those do? They're the best nutrients for erectile dysfunction. So studies show that men who regularly consume those kind of foods experience a 9 to 11% reduction in the erectile dysfunction. So think berry nectar in our Forever Living basket. Pomegranate juice, these are very rich in antioxidant. Pomegranate also, think urinary system. And the one product that identifies itself with pomegranate is our Ag+. So pomegranate juice improves nitric acid level. Nitric acid is your vasodilator. Ushaisikia yule msee? Yule msee ambao anaendanga kifungua njia ndo damu ifuate, anaitwa nitric oxide, NO. When I was starting the presentation and I was doing the physiology, there was nitric acid. Nitric oxide levels in the neurotransmitters that are released. If you are thinking NO, please think Ag+ in our products, okay? Think berries, think, cranberries, think all those things. Good. Garlic, please. You have a choice of picking a clove of garlic and eating it and wondering who you'll kiss after with your bad breath. Or you can just get garlic and thyme, okay, from your basket. So what does it contain, this garlic? Allicin, which is known to improve blood circulation. So you guys, you've noticed a repetitive cycle here. We're either improving circulation, we're either improving the nerves, we're either improving the hormones, we're either improving, because those are the building blocks of an erection. We're talking nerves, we're talking psychology, we're talking circulation, we're talking proteins, we're talking hormones. So anything that can pump in whatever angle, zote jazilia haba na haba, okay? So we're improving blood circulation and it enhances sexual performance. So you can swallow a clove or two, just like a tablet. But if you don't like the flavor, please include it in your dishes. I'm just buy garlic and thyme. We have a very good product to that effect. Salmon and other fatty fish, here I won't even bother to talk. They are giving you omega acids. We've already talked about omega acids. The minute you hear omega acids, please think Arctic Sea, okay? And then avocados. What are avocados for? Make it, add it to your salad, make guacamole, you put it on toast. But basically, avocados, with their high levels of zinc, it supports testosterone production. And you know, the low testosterone levels usually have been linked to erectile dysfunction. So think immunoblend, think nature mean, all the products that probably have high levels of zinc, throw them in there. So you see, you don't have to just focus on the male pack to say that now I'm improving the health of this man. There are so many products. Once you understand the science of nutrition, there are so many products that can give you the same, there are different paths that can lead to the same destination. And this, I usually urge that especially get to know what your patient has as a by the way. So yeah, may have erectile dysfunction, but what else does he have? Is it a heart issue? Is it a, so you would then tailor according to the product that hits two birds with one stone, okay? Good. We cannot wrap up this conversation without touching a little bit on andropause. And andropause here, kindly, if we're together, I want to see the word andropause. Mwanzo wanaume, tafadhali jitokeze, andika andropause. Nitakwambia kitu kuhusu andropause. Tafadhali tuandike tu andropause. Hata muko ready. Tafadhali andika tu andropause, and I'll tell you what andropause means. Aki, you need to hear andropause. People, you need to hear andropause. If someone has logged out, call them back in. Tell them if they miss everything else, they need to hear andropause. Okay? Now, kuna mtu ameandika andropause. I think that is my take home today, andropause. You see the way there's a lot of conversation going on about sijui menopause. Menopause. What happens to women when they age? My dear men, come close. After you're done typing andropause, come close. The same thing happens to you. Imagine you age, things start decreasing, things start failing, you start getting hot flashes. Imagine men get hot flashes. Okay? Now, let's talk about andropause and what it means for your sexual function. And this is how actually it translates. Naturally, men's testosterone levels are supposed to fall. From the time you're, like around 40 years, every year we expect around 0.8 to 1% drop of your testosterone level. This is natural, by the way. It's a natural graduated fall. And most of the time you won't even feel the effect of it, okay? But if you look at a standard, like a normal old man, and you looked at the testosterone levels, based on the, like calibrated for age, he will still have normal testosterone levels because we expect that natural decline. But there are men, around 10 to 25% of men, that have exceptionally low testosterone levels. Andropause can actually pull a number on them. And they present as the way menopause will present. And how does that? Usually, the female and the male reproductive organs, so estrogen, testosterone, play a role. And these roles include, they're not in the slide. Here, you're just listening to me, okay? In your heart, estrogen, testosterone does a very beautiful job. They take your bad cholesterol and they convert it into the good cholesterol type. And so as long as your estrogen levels and your testosterone levels are high, as a man, as a woman, respectively, usually you expect that you have a surplus of a good cholesterol and, a reduced amount of a bad cholesterol, which keeps you healthy. But the minute these hormones start depreciating, your bad cholesterol remains as bad and your good cholesterol starts dropping. What does that mean for your vessels? You have what we call hyperlipidemia. Cholesterol imepanda, imeanza kuclog blood vessels. Kidogo kidogo, your heart, mara heart attack. And that is why have you never asked yourself, why is a heart attack more rampant in women or men above 50 years? Simply because our hormones have failed, and we have a buildup of things that were being taken care of by the same hormones that we had when we were younger. So there are bigger issues to our menopause and your andropause other than just erectile dysfunction. Your heart could fail on you, okay? Number two, let's talk about bones. These same hormones, we'll call them the duo, estrogen and testosterone. What do? They work together. I'll be very quick here. I'm finishing up. They work together and they help to drive calcium in your bones, okay? The minute they go low, calcium is reduced greatly. If you should fall as a man, as a woman, above 50 years, you're most likely going to break something and need a hip replacement. Okay, and then now we go to lowered sexual desire, lowered activity, erectile dysfunction, and all those things. Okay, good. So there's breast tenderness on the man, there's breast swelling, there's infertility, height loss, because remember, height is a factor of your skeletal structure. So if at all we're losing calcium, it's shrinking on itself, osteoporosis, okay? All those things are coming in. Low trauma, broken bones, as I talked, called fractures, or low bone mineral density. Hot flashes in men, and other possible symptoms also include less energy, motivation, less confidence. Unexplained anemia, lower muscle mass. Fun fact, you lose 1% of your muscle mass every year as a man and 2% of your muscle mass every year as a woman when you go through menopause or andropause. Now, as I wind up, I cannot possibly leave you without showing you this slide, okay? This is your take home from, if you should forget everything, remember climateric reflex, remember the men's back, okay? This is what you need, because all the nutrition that I've taken time to explain is compressed in these 5 products. The other product you don't see here is the AG+. So let's enter one by one. Vitalize Men, my wonder drug. Emmanuel will tell you the day we didn't have Vitalize Men in Kenya, Swabra had to go look for it in Uganda. I cannot survive without this. My men would die, okay? So it contains vitamin C, vitamin D, and vitamin B6. I will summarize quickly. And these are essential and are the precursors for testosterone production, other than other functions. So of course, vitamin D will also go ahead, allows the use of calcium, phosphorus to present in the blood. But vitamin C, D, B6, you need it if you're going to form sperm production. So we need it. Okay, if we're going to form testosterone, these are the precursors. So you need the building blocks to start with, okay? Good. It also has vitamin E, which is an antioxidant, and this boosts the effectiveness of certain enzymes that are needed. Zinc and selenium, you cannot mention these two without talking sperm count. Very essential for every man. And I mean every man here above 30 years, please, kesho, get yourself Vitalize Men. You do not wait for the car to be broken. You take your car for service. How come you're not taking your reproductive organs for service? Vitalize them. Vitalize them. So selenium and zinc, as I said, have been researched in their critical care, also in prostate health. Lycopene. What does lycopene do? Usually prostate health, but can also help in your skin to prevent signs of aging. And these are other added benefits. But lycopene, we know it for complete prostate health, okay? Quercetin is to maintain your blood pressure. Remember, if your blood pressure is okay, we're talking about pumping blood okay. We're talking about, the recipient organ being, pumped blood okay, okay? I need to quickly narrow to saw palmetto. Saw palmetto is it's a herb that is in Vitalize Men that is a direct precursor for testosterone production. Okay? So this usually slows down production of dihydrotestosterone, which is a hormone that causes unchecked multiplication of prostate cells, but it also causes production of testosterone, the hormone itself. Okay? You can see how heavy it is. When I talk sperm health, when I talk sperm motility, when I talk prostate health, when I talk erections, I talk Vitalize, okay? Now, multi-marker here comes as the able helper to Vitalize. Actually, no, I will not call it a helper. They stand shoulder to shoulder. And the things I want you to remember that it has in it are 3 things: Q10. Q10 is a coenzyme, okay? What does Q10 do? Sperm motility, sperm concentration, sperm viability, sperm count, sperm, anything fertility. We're talking Q10. L-arginine, we already mentioned it up there, which is a precursor for most. It's amino acids, which now also lead to your hormones being formed. So this is known as a sex hub of the Incas, and it's a natural superfood found high in the mountains of Peru. And it has an exclusive blend of maca and other natural ingredients. I will focus on L-arginine here, which supports nitric oxide production. We dilate things that need to be dilated and promotes healthy circulation. Actic C, I cannot emphasize this enough. Why? We're talking about the omegas. You've seen the role of omegas in all the nutrition I've talked about. So when we're talking about Forever Actic C, we're talking about DHA, we're talking about the omega-3 fatty acids. And what I need to mention is there are some fatty acids, there are some EPA, DHAs that are not necessarily produced in our bodies. And so you have to consume them in your diet. Now, ole wako, kama hauna seafood in your normal diet, people in Nairobi, where do you get your seafood? Please go buy Actic, okay? You will even find people in Mombasa here busy buying kina tilapia. That is not seafood. So you get all this in food like salmon, in food like calamari, in food like, and if you can't go looking for those things, and someone will tell you lobster, calamari, and all those things, salmon, very pricey foods, just get Actic C. It has been concentrated into those beautiful capsules, okay? Perfect. We're talking about immune function because of omega-3 fatty acids, and then we're also talking about DHA being a mood enhancer. Mwanaume pia wanakuanga na makasiriko, by the way, when they're going through their andropause. Emotional health is bado tu hapo ndani. So you need Actic C for that. Berry nectar. This you thought was just for women. Olewe, no. What does it have? You remember those berries I was talking about? I will pick out 3 of them. It has cranberry, urinary health. It has proanthocyanidins. What do? They provide urine health support. And catch this, the vitamin C found in this is almost 20 times more compacted than what you find in your oranges. Okay, so there are other better sources of vitamin C. Okay, and then apple in there also has phytonutrients, okay, which is an antioxidant that helps Forever Aloe Berry Nectar a healthy and delicious drink. And I think it is a worthy choice to close our presentation with the mighty Aji. Yani, and as I finish this, I will put it out. Emmanuel, tafadhali, Aji Rudi. Why? Think nitrous oxide. Aji has it. It is the one thing that has stood above and mighty to give you nitrous oxide. But it packs, other than, it packs a delicious berry flavor. It has L-arginine. We keep mentioning the same things over and over, which is also a precursor, as I said, to create the miracle molecule nitric oxide. Okay, so when you convert L-arginine into nitric oxide, usually it plays an important role in what? Cardiovascular health. So you're not just talking about an erection. So dilatation is in the penis, but also dilatation, the dilatation of the vessels, the heart will appreciate that more. So usually patients with cardiac disease, they benefit a lot from Ag+, okay? Ag+ also contains very, very good antioxidants, and these play an important role in cell division and healthy immune function. There are studies that have been done that show that Ag also stands in place of potential cancers like prostate cancer. Why? Cell division, when unchecked, can sometimes lead to cancers, okay? So what are my take-home points today? Get the facts right, get the diagnosis right, and get the prognosis right. Most residents present sexual complaints with inadequate information. Haija fail, ni kuwa labda umeweka vikwazo, okay? So, how your partner behaves in an erectile dysfunction situation matters a lot because it impacts on your mental health as well. It impacts on how you even respond in future sexual encounters. And as we talked about meds, Viagra, which is a vasodilator. So Viagra will be emulating, release of nitrous oxide. Is not a controlled substance, but it's not for everyone. Context has to matter. And erectile dysfunction is much more common when patient is anxious, conflicted, and also feeling obligated by responsibilities. Thank you so much for your time. I will return the screen back to Emmanuel and potential questions. Thank you very much.
Hello, Dr.
Yeah.
We might have questions on the chat box.
Let me see if there are any questions. How will I meet them? How will I? Okay. Sorry.
Take 3, 4. We might have many, but you can speak.
How do I get to know the questions? Because there's so many chats. Emmanuel, kindly help me if you can pick out the specific questions. Okay, I can see one. Dr. Saidia, a guy with a sperm morphology of 3. Sperm morphology of 3 doesn't make sense because morphology refers to the appearance of a sperm and not the count. And you can't have a count of 3. When you talk about counts, we're talking of millions, and normal man is supposed to have anything above 15 million. So 3 is near 0. And if we're talking about sperm count of 3, literally, I will repeat that test, but if truly it is 3, which means literally 0, then I'd probably come in for a more conclusive investigation. Why is it that a man akikaa sana bila service, the testicles huuma? Hii inataka jibu. And how often do you need this? Testis zako sijui kwa nini zinauma, but it is not because there's a buildup of sperms. There is no such thing as a sperm build. Actually, if sperm was to build up, it is a medical condition called a spermoma. And a spermoma will present as an actual swelling. You'll feel like a pebble in your testis. And when we draw a lot of accumulated sperm. It will give you a lot of pain. So that is not as a reason. Usually, periods of starvation cannot give you a spermoma, okay? So how often you want to engage? And also probably I'd like to add that when I talk about all these supplements, I'm not talking about treatment modalities. I already covered the treatment modalities. We're basically looking at nutritional supplementation, okay? So that we can enhance and build a better starting ground, a better building ground for your better health as a man, okay? Alan, thank you very much. All the products mentioned are not sex enhancers. Very true. They revitalize healthy responses and performance. True. You don't just use when you don't use when performing. Very true. Even when not performing, as they help the body to function naturally. Very true. I'm looking for the questions and I'm going down. Agi is safer than Viagra. Absolutely. Anything is safer than. By all means, it is to mean that Berry Marker. I'm looking for questions. Emmanuel, I think nimejibu maswali ama?
Kuna za mwisho hapo down. Just scroll back.
Scroll, eh?
It will be last.
Is it
Maybe check.
Rough sex as a man, and is it normal or it's a psychological problem relating to ED? That's not a problem, that is preference. How do you solve problem of testis retracting to the body? That should have been sorted. This is a very good question. This diagnosis should have been made as a child, not as an adult. Retractile testes are testes that 1 minute they're in the sac, you can see them down there between the legs, and the next minute they're not there, the sac is empty. And so they're like rubber bands. So they sort of jump upwards. There's a path where they follow, and they can at one point be in the abdominal area and at one point be in the scrotal area. This is something of concern. Why? There's a reason why the testes are usually found outside of a body in the sac to control body temperature. Now, when they jump back into the abdomen, you have to remember that the body temperature is usually above that of a scrotum. And so formation of hormones, formation of testosterone, formation of sperms may be inhibited here and there. So actually, most men we've seen with low sperm counts, this sometimes can be a diagnosis. What can be done is we can anchor them, pull them down like a rubber band, and then fix them with a stitch. The stitch doesn't show on the outside, but that means things stay in. It's like we're sinking the stones. They don't jump up. They're not buoyant. They stay in the sack, okay? Maybe mention all men's vitality products that we have as per this training, very nature. That's a thing Alan was saying, that all these products do not just serve one purpose. It's not just vitality. One product can have different functions. But if I was to pick those that stand above and beyond, we have a berry nectar, we have a Arctic, we have a Agi, we have a Vitalized Men specifically. We also have the maca, we also have the royal jelly, even though I didn't comment on it today. I'm finishing, I'm coming down, I think I'm covering. Availability of a product, they are very much available. Kindly go back to the person that shared this presentation with you, and they will guide you on how to get them in this Kenya of ours, very much available, okay? What is the best combination for a man with oligospermia? I would say let's start with a proper consultation so that we see the reason for oligospermia, okay? Trust me, people usually charge for this kind of advice. Very true. I should charge all of you by asking all of you to buy Vitalized Men, okay, for all your men in your life. How often should we have sex? You people, anguka nayo. Is there a good combination of supplements for those with azoospermia? I would usually, from the studies I've done in my center, my go-3 are usually maca, Vitalize, and royal jelly. I will add a bit of Agi, and then probably repeat the semen analysis after 3 months just to see what exactly is going on, okay? How can you help a man with both low, and we go back to what is causing the low sperm count and erectile dysfunction? So thank you for answering. She did a whole lesson. Thank you. I think, please just listen, but msini judge. I don't understand why I'm able to sustain an erection for over 3 rounds of great quality sex only when I travel and return home. Please touch on Coolidge effect, because I'm quite a victim, honestly. Like I play safe, I don't indulge psychological support. I think some of these things may need probably a one-on-one and not necessarily, okay? Can I take all these supplements at once? Vitalize, Agi, maca? Yes, perfectly fine. And low sperm morphology, kindly, let's have a proper consultation for that and a proper treatment plan for that. I think I have covered all of them, Ivan.
Oh, yes, you have, and you've done amazing. Thank you so much. If you joined late, I think the best advice would be that the training will be on our YouTube channel so that you can revisit. Otherwise, we close it there. Asante sana Daktari for that awesome training. I want to thank all of you for participating. And again, I repeat, if you joined late, the training will be on our YouTube channel by tomorrow morning and you can revisit. Otherwise, let's close it at that. Judging from the comments, I think it's an awesome and interesting topic. Maybe a part 2 will do in the future, depending on the feedback we've received. Otherwise, thank you so much, guys. Have a nice evening. Thank you, Dr. for the awesome lesson. And close at that. Thank you so much. God bless you. Have a nice evening. Bye-bye.